Hi, this is Dr. Desmond Wai. Today we want to talk about hepatitis B follow-up. A lot of my hepatitis B patients don't come to see me after a while. And sometimes when they come, they actually ask me, Dr. Wai, every time you told me everything is okay, why should I bother to come and see you or see any liver doctor or any family doctor for that matter? You want to know the answer? Keep on listening. So hepatitis B used to be a very prevalent problem in Singapore. At one time, 5 to 10% of the population have hepatitis B. But since 1987, we actually vaccinate our newborn, every single one, unless the parent violently disagree. So all the newborn that are born after 1987 are vaccinated with hepatitis B, and they're protected from getting hepatitis B from various sources. So those that are born before that, they are still at risk, but overall, 1987 is a long time ago. So most of the people in Singapore have been vaccinated somehow, and the risk of hepatitis B, the prevalence of hepatitis B in Singapore is only at about 2.4 to 2.5%, very low. So we don't see that many hepatitis B people nowadays. But there are still people that are older, they're immigrant from China, from Vietnam, and whereby there are a lot of Hep B in these countries. So I do see these patients, foreign patients in particular, that have hepatitis B. So as a Hep B carrier, we see them every 6 months. So first question, who decides 6 months? Why not 4 months? Why not 10 years? Okay, why not 1 year? The rationale behind that is that hepatitis B is quite an unpredictable disease. They can be stable for a while, and for some unknown reason, they can suddenly flare up and become very ill. Besides that, hepatitis B itself is a cancer-causing virus. If they have hepatitis B, they have a higher risk of getting liver cancer at the risk of about 0.5% a year on average. Now, 0.5% is a small number, but if we are looking at 100 to 150,000 Hep B carriers in Singapore, 0.5% a year is a large number. As a matter of fact, hepatitis B, liver cancer is one of the top 10 cancer in male. So we know that Hep B causes cancer. That's why we want to pick them up early. And many studies have shown that the hepatitis B related liver cancer double the size every 4 to 5 months. So we believe that if we see them on a regular basis, like once every 6 months or so, we can pick them up when the cancer is still small. Okay. So I joke with my patients saying that if you have hepatitis today, there's no liver cancer, very good. But if your cancer starts to develop from tomorrow, okay, in 6 months' time, your cancer will still be small. We can still pick it up at the early stage, at the curable stage, and we can still cure your liver cancer. For that matter, the AASLD and the EASL, two authorities in liver diseases from the US and Europe, they recommend that we should see hepatitis B carrier on a 6-monthly basis with a blood test, including an alpha fetoprotein, and also with a scan, like an ultrasound scan, to look for any liver cancer. Why we need AFP and ultrasound scan? And that's because not all the liver cancers secrete alpha fetoprotein, especially in the early stage. So I've seen a lot of small liver cancer that patients have a normal AFP. At the same time, small liver cancer can sometimes be missed by the ultrasound scan. Ultrasound is cheap, easily available, but it is very operator dependent. So in order to pick up any early liver cancer, we do both an alpha fetoprotein and an ultrasound scan. Some authorities even propose that we should do a non-contrast MRI, which is no risk, zero risk, because there's no contrast, there's no radiation for MRI, and it's much more accurate than ultrasound scan. But the price of that will be in the range of maybe $600, $700, compared to an ultrasound scan, whose price is $200 to $300. So I do not foresee that we can do a non-contrast MRI on a regular basis because the costs are involved, okay? So therefore, I told my patient, we do all this to look for cancer. The risk of cancer is low. It's 0.5% a year on average, but it is more than zero. So under expert guidance, we want to check out the liver cancer with screening tests, a blood test, and the ultrasound scan every 6 months to look for cancer. So if you have no cancer, that's great. But if you have no cancer for the last 30, 40 years, does it predict that you have no cancer in future? Unfortunately, no. So you can have a normal alpha fetoprotein, normal ultrasound scan all your life, but if the cancer decides to develop, I'm sorry, they can still develop. So a normal regular test does not preclude you from having cancer in the future. So all the Hep B carrier, you need to do a 6-monthly follow-up with your family doctor, report the clinic. You don't really have to see a specialist. Of course, I welcome you, but you can just see a family doctor. They will do a alpha-fetoprotein, an ultrasound scan, and maybe some other liver test. If there's no cancer, normal AFP, normal ultrasound scan, no need to see us, just go ahead to continue, okay? Seeing your family doctor. But if there's any abnormality detected, maybe it's time to see a specialist like myself or any government hospital. To sum up, hepatitis B is a pre-cancer condition. The risk of liver cancer is very low, 0.5% per year on average, but it's more than zero. We do encourage and recommend that all the Hep B carriers see the doctor on a 6-monthly basis, do an ultrasound scan, and do a special blood test called alpha-fetoprotein. A normal alpha-fetoprotein and a normal ultrasound scan in the past does not mean that you will not develop abnormality in the future. So hepatitis B person, Hep B carrier, 99.5% you'll be okay, but you don't want to be the unfortunate 0.5%, and you also don't want to have any cancer miss that the cancer developed is beyond curative age. Okay, this is Dr. Desmond Wai, Gastroenterologist and Hepatologist at the Mount Elizabeth Novena and the Forever Hospital. Thank you.